Jim Jordan walked into Congress and absolutely tore apart Obama and the entire Democrats with this fiery speech.
Pre-existing conditions. There's no one on this committee who would support denying coverage to Americans with pre-existing conditions. I was hoping we could focus on those issues, but unfortunately, like so many other hearings in this committee, we're not. Rather than working towards bipartisan solutions, this committee is once again looking to score political points by attacking anything the Trump administration does to improve the health care for American people. Next door in the Judiciary Committee, we reported out multiple bills that would have had meaningful impact on the cost of prescription drugs. Judiciary Committee spent months working on ideas to cut down on red tape, make improvements to how affordable generic drugs come to market. Those bills were all bipartisan. I was pleased to vote for them. In fact, many of them passed the Judiciary Committee unanimously. We could be talking about bipartisan substantive issues here today. Instead, we're going to talk about why the Democrats are upset that the administration thinks Americans deserve something better than the failed ideas of Obamacare. Under Obamacare, make no mistake, Americans saw their premiums skyrocket and their health care choices reduced. The majority's title for today's hearing is Trump's efforts to undermine the ACA. Undermine the ACA? Think about what we were told when this bill passed now, what, 9 years ago? I call them the 9 lies of Obamacare. Think about this. Remember this one? If you like your doctor, you can keep your doctor. Y'all remember that one? How about the one, if you like your plan, you can keep your plan? We were told by the President of the United States premiums were going to go down. He then got more specifics. Premiums will go down on average $1,500. He said deductibles would decline. 5 false statements right there. Oh, remember this one? This was in the fall of 2013. Remember this one? They told us the website was going to work. They told us the website was secure. Your information would be secure there. They told us that these co-ops were wonderful, end-all, be-all creations. 23 were created. Guess how many are still in existence? 4. The other 19 went bankrupt. Oh, and the other 9th lie, first they told us it's not a tax. Then they went to court and said it is a tax. Now they're saying, no, it's not really a tax at all because you can't tax them now because the individual mandate is gone and there's no penalty. 9 different lies we were told about Obamacare, and the hearing is titled, How Trump's Efforts to How Can You Undermine Something That's Already Failed? Now, I don't expect my Democrat colleagues to acknowledge it, but the Trump administration has worked to increase competition, transparency, and quality of care in our healthcare markets. Increased competition, transparency, and quality of care are all goals we all should share. I don't know if there's anything the Trump administration could do, though, that would satisfy my colleagues on the other side of the aisle. The timing of this hearing is also particularly troubling. Just yesterday, the Fifth Circuit began oral arguments in a case that could invalidate Obamacare due to recent changes to the law. The administration chose not to defend Obamacare in this appeal. That decision is entirely consistent with similar actions taken by other administrations in the past for other laws. But here we are. Democrats sought to have the director of OMB here this morning to testify about how the Trump administration made this decision. Could have had a witness from HHS, could have had a witness from DOJ, but nope, they wanted someone from OMB. Make no mistake, this isn't about serious congressional oversight. This hearing is about trying to manufacture a controversy based on anonymous sources and news reports. This hearing is just another attack on President Trump, and it's disappointing. We could have had a productive discussion today about real healthcare policy. Hopefully we can still do some of that. I hope we can. I know that's what our side's going to try to do. We could have had a real discussion about how to make healthcare more competitive, more transparent, more cost-effective, and with better quality of care. And I hope at some point this committee will stop its relentless political attacks on the administration and actually focus on something that makes a real difference in the lives of our constituents. Again, I want to thank our witnesses. Come in here and tell your story. But I think the country deserves something better than the lies we were told. Anyone remember the name Jonathan Gruber? Remember that name? New York Times called him the architect of the Affordable Care Act. And he's the guy who was caught on tapes a few years later. Remember calling us all stupid, calling Americans stupid for buying the lies that the Obama administration told us when they passed this thing? Again, it's not my words, it's Jonathan Gruber, the architect of Obamacare. But somehow the minority or the majority says that this is a hearing on efforts to undermine a law that was passed with so many false statements made about it. Mr. Chairman, I yield back.
Thank you very much. Let me be clear to the witnesses.
If there's one thing Jim Jordan has always been good at, it's cutting straight through the political spin, and that's exactly what happened in this speech. You can hear the frustration in his voice because, from his perspective and from the perspective of millions of conservatives at the time, this hearing was never really about fixing health care. It was about attacking President Trump. Again. Jordan starts by pointing out something most Americans were exhausted by in 2019. Congress had become trapped in endless political warfare while everyday people were dealing with real problems. Healthcare costs were rising, prescription drugs were expensive, deductibles were crushing families, and instead of focusing on practical bipartisan solutions, lawmakers were once again relitigating the Obama years. And that's where Jordan goes right for the jugular: Obamacare. Now, whether people support the Affordable Care Act or not, there is no denying that many Americans felt burned by the promises surrounding it. Jordan listed them one by one because conservatives never forgot those lines. If you like your doctor, you can keep your doctor. Americans heard that over and over again from Barack Obama. Then millions of people received cancellation notices. Same thing with health plans. People were told they could keep the coverage they liked. Then suddenly their plans disappeared because they didn't meet new federal requirements. That anger was real. Conservatives used those broken promises for years because it symbolized something bigger than just health care policy. To them, it represented Washington elites overpromising massive government programs while ordinary Americans dealt with the consequences. And Jordan knew exactly what he was doing when he called them the 9 lies of Obamacare. That phrase wasn't accidental. It was designed to frame the entire debate around trust. Because once voters stop trusting politicians on major reforms, everything else falls apart after that. What's interesting looking back now is how much this fight shaped modern American politics. Democrats viewed Obamacare as one of the biggest achievements of the Obama administration. Republicans viewed it as government overreach that increased costs and reduced competition. The country was deeply divided over it, and speeches like this became rallying cries for conservatives who believed the media ignored the failures while endlessly attacking Trump. Jordan also tried to make another point that often gets overlooked today. He highlighted bipartisan efforts on prescription drug reform happening in the Judiciary Committee. That mattered because Republicans wanted to argue they weren't against fixing health care. They were against centralized government control and what they saw as bloated bureaucracy. Jordan was basically saying, look, we can actually work together when the goal is practical reform instead of political theater. Then he pivots back to the Democrats' hearing and says something that became a constant Republican complaint during the Trump years. Every hearing turned into an anti-Trump event. That was one of the defining dynamics of Washington between 2017 and 2021. Republicans accused Democrats of being consumed by investigations, outrage, and media spectacles instead of legislating. Democrats argued they were holding the administration accountable. Both sides fed into the polarization that completely dominated the country. And remember the timing here. This was during the legal battles over Obamacare after Congress eliminated the individual mandate penalty. Conservatives believed the law was fundamentally unconstitutional at that point. The Trump administration choosing not to defend parts of Obamacare became a massive political controversy. Democrats treated it like sabotage. Republicans treated it like correcting a constitutional mistake. Jordan's speech also reflected something broader about the Republican Party during the Trump era. The party had shifted away from cautious establishment-style messaging and toward direct confrontation. Instead of carefully softening criticism, Republicans like Jordan went aggressive. They framed Democrats not just as wrong but as dishonest. That tone connected with conservative voters who felt ignored for years by the political establishment and legacy media. And honestly, whether people agree with Jordan or not, the speech still captures a huge political reality in America. Trust in institutions collapsed because Americans kept hearing promises from politicians that didn't match their lived experiences. If your premiums rose, if your deductible exploded, or if your doctor changed, then hearing politicians celebrate Obamacare felt insulting to a lot of families. What also stands out is how familiar this all sounds today. The arguments haven't changed much. Americans are still frustrated about health care costs, prescription drugs are still expensive, insurance systems are still complicated, politicians are still accusing each other of caring more about ideology than solutions. The difference now is that the political divide has become even more intense. Back then, this was already a heated hearing. Today it would probably explode across social media within minutes, with clips everywhere and both sides treating it like political warfare. But Jordan understood something important here. A memorable political argument is not just about policy details. It's about connecting emotionally with people who feel betrayed or ignored. That's why he kept repeating those Obamacare promises. He wanted viewers to remember exactly what they were told years earlier and compare it to what they actually experienced. For conservatives, this speech became part of a larger argument that bigger government promises almost always come with hidden costs. For liberals, Jordan's attack ignored the millions of Americans who gained coverage under the ACA. That's the core divide. One side focused on expanded access, the other focused on affordability, choice, and government overreach. And that debate still defines American politics right now. If you enjoyed this breakdown, make sure you like this video, subscribe to the channel, and drop your thoughts in the comments. Do you think Jim Jordan was right about Obamacare, or do you think Republicans never offered a real replacement? Let me know below.